Hi, everybody. This is Donna with Dr. Osama's office. I'm actually Dr. Osama's physician assistant, and today we're going live to talk about probiotics. I actually want to give some wisdom pearls of what things that you should be looking out for and what are probiotics. So we'll start with the beginning. So with probiotics, there are 3 different strains that are things that we have to kind of look for, and it's also going to be dependent on what your needs are. So the different strains are lactobacillus. Usually this is the one that you really want if you're looking for something that will help with digestion and also with immune function. A lot of times the examples are when some patients are having a lot of bloating. That could be a good example. The second strain is actually bifidobacterium. We actually see this in more beneficial with people who really need to support their colon cells. A lot of times, what's so important about this type of bacteria, they actually produce a lot of short-chain fatty acids, and it actually helps us produces the energy cells for our colon. This is so important when it comes to metabolic processes like insulin sensitivity and also memory. We also tell a lot of our patients who are struggling with weight, this is actually the type of bacteria or probiotic that might be right for you. Last one that is also popular that I would like to cover is Saccharomyces boulardii. This is actually a good probiotic whenever we're recovering from like an infection or actually after taking after taking antibiotics. So this is the type of bacteria that's my go-to, especially whenever we're having traveler's diarrhea or if we just got off of antibiotics. This is the one that you need to have. We actually like it because it's so important that we recover our gut after it's been wiped out with antibiotics. A lot of times we want it to have a good barrier between the intestinal wall as well as our probiotics to help us recover from any damage or leaky gut. So Saccharomyces is actually a good one to kind of start off with. The second point, good pearls for us to have is actually looking at the diversity. So a lot of times, as we consume probiotics, they have to kind of get through our stomach acid, and we also have to see how much it can survive in order for it to be effective in our gut. So generally, the rule is the more diversity, at least a minimum of 1 billion, would actually help us survive the gut. So whenever we're looking at diversity, at least a minimum of 1 billion is going to be what we like for a lot of our patients to at least take to start off with to actually see some good benefits from it. When we also are looking at labeling, we got to really watch out for those binders and fillers. Like anything that includes lactose in it on the ingredient list, this is where you have to watch it, or even cornstarch, because a lot of times this is where we get a lot of gas and bloating, and not all probiotics are made the same, so you have to really watch and look at the labels, that you have to be specific on if what's in the ingredient, are you sensitive to these things. We also want to check the expiration date, and we have to make sure we choose the right brand that actually specifies the amount of live strains and the exact strains in it. So you have lactobacillus, but there's different types in between the lactobacillus as well. Or even Saccharomyces, like boulardii, they also have little subcategories too. So you want to have a good probiotic that actually can give you the specific strains as well, because then at least we can look at the strains, look at the articles, and be able to actually commit to looking at which one is well studied and also what are they good for. A lot of times another tip is actually that we want to take probiotics that actually is refrigerated, because we know that it's going to last a lot longer. That's part of it being preserved. And usually another good tip is that with probiotics, you will actually want to take it with meals or actually after meals. The reason why we do that is because when you take or consume probiotics, it has to survive that stomach acid and bypass that. Whenever we eat, it actually helps increase the alkalinity, which is the pH of the stomach, to help the probiotics survive and bite and get to the small intestine and get to the colon where it belongs, right? And so we actually like the fact that it's either with meals or after meals, and that's how you're going to optimize the effectiveness of the probiotic. So there's going to be also different signs because, like I mentioned, not all probiotics are made the same, and there's also going to be signs that you might be taking the wrong kind. Some symptoms like bloating, or actually you start noticing irregularity of your bowel movements whenever you stop it. So it's kind of like an over-dependent, or that you can't wean yourself off. So that's actually a sign that you might be on the wrong one because you're feeding only a certain strain. And so we have to keep the diversity going for our gut, right? That's all about diversity. The other tip that we mentioned is that with irritability about whenever you're taking probiotics, or it makes you kind of feel funny, then or like you're kind of sensitive, or it makes you have a lot of diarrhea, those are probiotics that probably isn't the right one for you. So you can't just pick off the shelf. You have to really read what is your needs. But specifically, I feel like a lot of our patients, because there's so many ranges, I can only give some certain pearls that will help it, but everybody's gut microbiota is very personalized. You go through a certain journey. We have to understand why you're bloated, why you have diarrhea, why you have to rely on so much probiotics, because with a lot of times, stool studies is going to be the biggest way for us to be able to picture map your gut. And it also tells us the journey on what type of strains that we have to actually balance. So not one probiotic fits everybody, and it could be a certain journey for every individual person. So here are at Dr. Osama's office, and especially the way we practice, we really think the health of our patients actually starts with the gut. And who would be better at telling it than our bacteria? And this is going to be where stool studies is so important, whether even if you're not having diarrhea, you're having normal bowel movements, or you're having constipation. It doesn't have to be diarrhea for you to have a stool study. This is kind of like a health report of your gut. So there's a stool studies that we use that's called GI Maps. It's actually covered by Medicare, I believe, and the cash pay option for our patients can be up to $400. But I think there's a lot of value with it as well, because you can't find this type of breakdown with different bacteria. What is the beneficial bacteria that's in your gut, and also the bad bacteria that's in your gut, to know how much we need to use. So the journey really starts with looking at the stool studies, and we also look at, to personalize, is there's something that we had a parasitic infection back in the day, and now it really disturbed our gut to where it's only flourishing a certain type. We really recommend stool studies for a lot of our patients, just so that we can understand if it's also affecting anything else like skin rashes, acne, if we're also seeing a lot of UTIs, are we having a lot of yeast infection. So like I said, if you are interested in discovering what is your gut story, I would really encourage us to make an appointment with us. You can call us or text us at 281-746-9284. And please post any questions or comments you like down below. And I will be active to send you articles and anything else that would actually be helpful to help you with your journey. So please let me know. I hope you find this video interesting and helpful for you to even start with some general tips. But if you want something that would be more specific for you, feel free to call us so that way we can personalize your journey. Thank you.